Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant / associate and health educator. So I'm going to do a different video today. It's not my usual running vlog. But I wanted to speak very briefly about President Joe Biden's mandate about the COVID-19 vaccine. So by now, if you've followed the news even a little bit, you've heard about this mandate. So the mandate, one of the things, or a couple of things in the mandate is, number one, any business that has more than 100 employees has to have their employees vaccinated, and any hospital that receives funding from Medicare and Medicaid in terms of reimbursement for their patients has got to have their employees vaccinated. One of the things that President Biden said in his speech was this is not about freedom or personal choice. And I wrote some things down because I don't want to misquote him, and I don't want to give inaccurate information, because I have very strong opinions about the wording that he used and where I see this going. So in the beginning, there were a lot of misgivings. Well, there still are, but there were even more misgivings about the COVID-19 vaccine. Were people going to take it? A lot of folks I talked to, I'm Black American. We've got the history with the Tuskegee experiments and other things that were done to us as a people because we're black. So there is somewhat of a distrust toward what's considered the standard mainstream medical field. So a lot of folks have been very wary of this vaccine, but people have tried, and I think in large part people have tried to embrace it. Now I still have friends and family who have not had the vaccine. They've asked me, well, what do you think I should do? At this point, and I've mentioned this in other videos, I honestly don't know. I know what I did. I got vaccinated. I got my Moderna 1 and 2, and I'm going to get the booster, inshallah, Lord willing. And that was more to protect my patients. I work in a hospital where I see very frail patients. Some of them are in ICU. Many of them have compromised immune systems. I did not want to take a chance that I would come to the hospital with COVID, being low symptomatic or asymptomatic, thinking that I just had the sniffles from seasonal allergies or something, and give them, in fact, that I would have COVID and then give it to them, and quite possibly be the cause of their demise. I work with patients who have had COVID, and it's been very devastating to them. It should be noted a lot of these patients have got multiple morbidities, including things like poorly controlled hypertension, diabetes, obesity, morbid obesity, in fact, and advanced age, just to name a few. But I wanted to protect them from me, and also protect my family members. I do have elderly parents. I didn't want to pick up COVID from the hospital, possibly, from an unvaccinated coworker, possibly, and then bring it home to my family. So I said, well, let me do what I feel is a responsible thing for me to do and get vaccinated. That was the choice I made for myself. I don't want to speak for other people. What I've seen is steps toward trying to get people vaccinated, which it's been sequential. So first it was, the black community, they always got to bring out some rapper. I work in Anacostia, Southeast, so they bring somebody in the entertainment industry to kind of, do something. Yo, vax up and mask up, because it's thought that we can't understand just giving regular instructions for things. And I've seen some of these events. I've seen the events where they give people incentives to get vaccinated, so gift cards, and then opportunity to have your number drawn in in a lottery, or a lottery for a free car, or a lottery ticket. And when these things have been going on, I've spoken to people that are like, I'm still not getting it. So when that didn't work, there's more aggressive and more invasive measures that were taken. Well, you can't go to the movies if you haven't gotten a vaccine. You can't go to theme parks. You can't travel. Well, then people, with the technology we have now, people are like, well, forget it. I'll just stay home and watch Netflix or something. Or I don't have to go to a theme park. Or I just won't travel. And you've got restrictions with some travel bans. Well, then that didn't work. So then, there was initiations to affect people's livelihood. Well, you can't work here if you're not vaccinated. Well, I personally know fellow clinicians, nurses and doctors alike, who have told me that they will not get vaccinated, period, even if they have their jobs taken away or their medical license. I have a medical license as a physician assistant. It's something that for which I worked very hard. I really value it. I really love practicing. I enjoy practicing medicine within the parameters of a physician assistant. I don't want to have that taken away from me. But that's not why I got vaccinated. I got vaccinated again to protect my patients. But what's going to happen when the people who say, well, listen, I don't even want to work if it comes to a choice of me either being vaccinated or not working, I just won't work. Well, are you going to hold people's food stamps and public assistance that they're going to need, because they no longer have a source of income? And then, what happens if they say, well, okay, fine, I'll just live in a tent on a street? We have a huge homeless population here in Washington, D.C. I wonder how many of those folks are actually vaccinated. That's just a rhetorical question. I have no idea. If people just decide to live on the street, what are you going to do then? Are you going to send people around to people's tents, or maybe their apartments or homes, provided that they haven't gotten kicked out, like they do with the Census Bureau? Are you going to send somebody around to say, well, how many people in your house? Well, okay, let's say you have 6. Well, how many of them are under the age of 12? Well, nobody here is under the age of 12. Well, how many of them are vaccinated? Well, why do I have to tell you that? Well, you have to tell us that. Well, who's unvaccinated in your household? Are you going to start issuing fines to families who have family members living under their roofs who are not vaccinated and are eligible to be vaccinated? Are you going to have people reporting each other? Do you report your family member or your neighbor who isn't vaccinated? I guess my question is, and this is certainly a rhetorical question, what's the end result of this? If you can download a vaccine passport on your phone as an app, do you next have to download something that says you're unvaccinated? So I have a card that says I'm vaccinated. Well, you have to have a card that says that indicate that you're unvaccinated. Well, you have to wear something, maybe some kind of wristband or something, or anklet that has some kind of monitor on it that lets people or businesses know that you're unvaccinated. I just don't know where we're going with this. And also, are we, meaning our government, going to entertain other modalities that may provide either a cure or some type of something that lessens the symptoms of COVID, like things like ivermectin and hydroxychloroquine? There's a lot of unanswered questions. America just left a country where, the people's rights were apparently so oppressed that they were willing to hang off the side of a moving airplane and risk plummeting to their death, as some did. We're worried about this Kim Jong-un in North Korea. Is he going to set off a nuclear warhead, where we're, aimed at us? We're worried about these countries where people have dictatorial control over their citizenry. But then it seems like we're going in that direction here. I could be wrong. I hope that I am. But I'd like to know what your thoughts are on this. Again, I'm not a big shot. I'm just a clinician, little worker bee with a small vlog. But I wish you all the best of success in your positive endeavors. I wish you all health and happiness. Peace. Take care.